Welcome to Legislative Report with Representative Doyle Heffley. I'm your host, Nick Ruffner, talking today with Representative Heffley about the major issues facing Carbon County and our Commonwealth. Representative Heffley, thank you for joining us today. I know we have a lot of important issues to talk about, but chief among them is the state budget, an issue that continues to be in the news today even. Yeah. The budget, a more than $29 billion state budget that does not include tax increases.
Yeah, and I think that's one of the keys. Obviously, as we looked at a lot of the opportunities in this past budget cycle, it was no taxes. Working class families and businesses across the state of Pennsylvania, we don't need to be going back and asking them for additional tax revenue. I think it's important that we manage our resources here in Harrisburg and provide the funding necessary for these different programs without having to continually go back to the tax collectors or taxpayers. And I think that was one of the keys as we work through this. Obviously, we spent close to $29.05 billion in this budget, which represents a 1.5% increase in general fund spending, which is slightly below the rate of TABOR and inflation. So, and that's a good indicator, and you know, definitely prioritizes where those dollars are going to be spent. There are increases this year in education spending, K through 12, special education seen an increase for the first time in 6 years, and I think that was really important and some of the things that we worked on through the process. Obviously, the governor had signed a budget a couple of days late, but the House and the Senate, we did get the budget passed on time. The governor was looking for some additional help with pensions, which I'd like to see as we move into this fall session, addressing these pension issues. But I think the important thing is to realize that we did get everything done in the House and the Senate, and there was no delay in any kind of funding for any of those vital and important programs here across the state. And I think that's an important issue.
You mentioned spending within our means, but also prioritizing spending. I believe that this year's budget has the most spending on education in the state's history.
Yeah, it does. I mean, we really made it an emphasis to get that additional money out for basically early childhood education, special education, as well as K through 12. And we're looking at, like I said, almost $10.5 billion just in education spending alone. And a lot of those increases also go to pay down the pension liability. That's part of the employer cost for hiring for the employees and making sure that that we were able to meet our obligations and our commitments to those pension payments. And that was was quite a bit of money, but it is something that has to be paid down.
And you mentioned the pension issue, and that was a big point of debate whenever the House was in session in late June leading up to the budget. Nothing has been done as of yet, but there are some plans on the table to address the state's pension crisis. And this is an issue that affects school districts and a lot of different entities across the state.
Yeah, it is probably the biggest opportunity that we have as leaders here in the state to get something accomplished. The public pension system consists of two entities. You have SERS, which is the State Employees Retirement System, and PSERS, which is the Public School Employees Retirement System. Between those two funds, I believe they're funded, I think the numbers are right around 60 to 66% funded, which leaves us with over a $50 billion liability in those funds going forward. What had happened in the past was the previous administration under the Rendell years, and this happened right at the start of those years, they did not put the employer match into the pension fund. And then with the underperformance of the stock market, when you look at with the real estate or housing bubble and also the .com bubble, it really put that stress on the fund as far as making the earnings that were required. So right now we're looking at considerable debt to pay down in those liabilities. Somebody put it into perspective, and I think it was really interesting to say, if you look at what we spend per child just in education alone, they're looking at about $15,000 per pupil per year if you average out all the state and local dollars that go into education. In order to meet our current pension obligation, we would have to spend $17,000 per pupil. That's an extra $2,000 to pay those pension obligations down per year. So that's a considerable cost. So there's two ways that they can look at doing that, and one of the ways is to shift to all new hires into a different type of pension program, or what they call a hybrid plan. But I think it's It's very important that people understand that anything that we do would not affect any current retirees. Current retirees, they were committed, they were promised by the state, they have a contractual obligation with the state for those pension obligations. Current employees are the same way. Anything that we would do moving forward with the plan, which is designed to save about $11 to $16 billion, would be a hybrid plan. And what that would mean is as the employer or the employee would get a pension up to the first $50,000 of income. They would get a defined benefit, and after that they would be enrolled into a 401k style plan where they would put in, I think 7% of their salaries, and then also the state would match that. So they would still be, it would be a hybrid plan. It's obviously it's much more attractive than what most of the public or the private sector plans are right now, but it would save the taxpayers moving forward about $11 to $16 billion. So I think we have to look at, one thing is like we had commented earlier, is making sure that the state is making their obligations to the pension currently, but then also looking at the system moving forward and what can we do to ensure for all those public sector employees that they're going to have their pension, but at the same time that the taxpayers are going to be, or aren't going to be going bankrupt having to pay for them.
There obviously is a need for pension reform, but do you get the sense when you talk to people in your area and across the state that there are misconceptions about what pension reform would actually mean for them?
Yes, I think so. I mean, we talk to folks that are currently retired, and they'll come up to me on the street and say, hey, is there anything that's going to affect our pension, or we don't want to lose our benefits? And no, there's nothing in any of the proposals that are out here right now that would alter or affect anybody that's currently receiving a pension. So it would not do that at all. But the one thing that it will do is as we work on this pension issue, is it's definitely going to ease the burden of the property taxpayer. I mean, a lot of your school district funding at the local level is done through the collection of property taxes. So we're living in Carbon County. Property taxes are probably the #1 issue, or they are the #1 issue. Something that we've worked very hard on here in Harrisburg and trying to address. But also that a lot of that $50 billion that we talked about in pension liabilities is going to come from property taxes if we don't fix that issue. So I think that's something that with an extra drive to get something done on pensions.
And property taxes is one of the most important issues facing the Commonwealth. In the past, you've called it an unfair system, and people have to pay to stay in their house. Sometimes they're deciding whether to pay for medicines or food or their property taxes. Tell me about that issue in Carbon County and the impact that it has on people.
Well, it's devastating to our communities. It really, a lot of senior citizens who have invested a lot into their home are now looking at wanting to retire and sell those homes, and they're losing value in the home because of the property tax burden. A lot of senior citizens that are on fixed incomes and working class families that haven't their wages and pensions have not increased to meet the increased demand for property taxes. So you look at the issue with heating, home heating oil, which is on the rise, electricity rates due to some really terrible federal policies, which are on the rise, and then couple that in with increasing property taxes, and it's really putting a huge burden on our working class families and also our seniors. I think shifting away from property taxes to fund our local schools on a different system is crucial, both for working class families, but also for our economy moving forward.
And it's an issue that you've been active in Harrisburg, even authoring a bill to make sure that whatever is passed and signed into law eventually on property tax reform, and there are many options, would fall within the bounds of the Constitution.
Yes, and I've taken all the above approach. I would love to see total elimination of property taxes. I think that's what we're pushing for. House Bill 76, we were able to draft that into an amendment and file that onto to a bill earlier this term, and get that up to the floor for a vote. I think that was critical to do that, to continue to work on property tax reform, just to see where we're at, and Also, we passed 1189, which would be a local option for property tax shift. But if I can vote for a 10% reduction, 20% reduction, or 100% elimination, I'm going to vote for anything and everything I can to deal with what is probably the biggest issue is the burdensome property taxes. It's not an equitable system, and it really punishes the homeowners.
And you said you're in favor of anything that would lead to the elimination or reduction of property taxes for folks. You can't put your eggs in one basket and say we have to get a particular bill passed. You'll support anything. Yeah.
Well, I think obviously the bill that most people have talked about and looked at would be House Bill 76, Senate Bill 76. I think that's probably one of the best and most viable options right now to perform that property tax shift. But there's also a series of bills, and currently we're in conversations I've had conversations with colleagues about other proposals that are out there to increase the amount of revenue that the state puts into the schools. But anything that we would do, we will be looking for those local districts then for property tax reductions, not just additional money going into to schools, but the money going in that's going to offset those property taxes and the expansion of the rent rebate program. So there's a lot of different options that we're looking at, and I've just taken all the above because we have to fix this issue.
Is it a difficult issue to address because it is so different across the different geographic areas of the state? Say it's different in Carbon County than it is in Washington County?
Yeah, I think it's different in Carbon County than it is in Philadelphia County, for instance. And I think that we're a very diverse state. In some parts of the state, they don't view property taxes as a problem. In Carbon County, it's a huge issue when you see property tax payments that are higher on a monthly basis than mortgage payments, then that's a great concern. And the realtors in our region and across the state have come on board and supporting some of the bills that we have out there for property tax elimination. I think that's a great first step.
So back in session in September, what are some of the issues that are going to be on the House's agenda whenever it returns to session?
Well, I think there's a couple of big issues. Obviously, pension reform, as we had talked prior. I think that will be something that we'll be looking at in the upcoming. Also, I think there's a couple of things that obviously with at the federal level with the Medicaid expansion and a lot of folks really concerned about that, as I am, the additional burden that will put on the taxpayers. Right now, 1 in 6 individuals are on some kind of public assistance and Medicaid or welfare. With that expansion, that would put 1 in 4 Pennsylvanians on public assistance, which would be a huge burden for taxpayers. And that's why I've been somewhat reluctant. Just this past year in our budget cycle, one of the opportunities that we had was we had seen $340 million cut in Medicare reimbursements and Medicaid reimbursements to the state of Pennsylvania, which really hurt our hospitals and our local providers. Something that we had to work at backfilling as we went through the budget cycle, and then an increase of over $250 million in mandates from the federal government for Obamacare. We've also seen a lot of folks that have been losing their insurance due to huge increased costs in health care due to these federal mandates. So I think we're going to have to continue to look at that. If you look at everything, between your property tax and then your medical costs, it's really crushing our working middle class families in Carbon County. And I want to work on avenues where we can help them.
And thank you for that response. We're going to talk more about Carbon County and some of your initiatives on the local level when we come back. You are listening to Legislative Report with Representative Doyle Heffley. We will return after this.
Did you know that Violet Oakley was the first female artist to receive a large commission for artwork done in a United States Capitol building? In 1902, Joseph Houston, designer and architect for the 3rd Harrisburg Capitol building, commissioned Violet Oakley to paint murals for the governor's reception room. He believed that Oakley's contribution would add interest to the building and act as an encouragement of women of the state. Prior to beginning her work for the Capitol, Oakley set out to England to conduct research for her murals. Upon return, she decided to center her artwork on William Penn and the founding of Pennsylvania. Oakley made sure that Penn's ideals of justice and peace could be seen throughout her work. In 1906, she completed 13 murals titled The Founding of the State of Liberty Spiritual, and was placed in sequential order around the governor's reception room. These murals were some of the first to be installed in the Capitol. When Edwin Austin Abbey, another artist for the Capitol, died in 1911, Oakley was offered another opportunity to create murals for the unfinished Senate and Supreme Court chambers. Her work on the Senate murals, including International Understanding, was completed by 1919. Oakley then completed the Supreme Court murals, including the Divine Law, by 1927. Oakley is said to be the principal artist for the Capitol, with a total of 43 murals on display. She remains one of the greatest muralists in the United States. Now you know.
Did you know that on October 4th, 1911, the statues that greet visitors in front of the State Capitol building in Harrisburg were dedicated to the citizens of the Commonwealth? In 1902, George Gray Bernard was commissioned to design the figures that embellish the front of the Capitol building. During the installation period, Bernard explained to the General Assembly what each sculpture symbolized. The Southern group, titled The Burden of Life, depicts the story of Adam and Eve followed by the fall of man in the forms of despair. The Northern group, titled Love and Labor, depicts male and female figures reaping fruits of labor and advances to a new Adam and Eve who gaze westward into the future. Recently, both sculptures underwent restoration to prevent further deterioration from their natural beauty. Now you know.
Welcome back to Legislative Report with Representative Doyle Heffley. I am Nick Ruffner, and we return here with the representative. In the first segment, we talked more about some issues that are important here in Harrisburg. Obviously, they're important back home in Carbon County as well. We'll talk about some issues that directly impact Carbon County now, and you've been very active on the front of fighting opioid and prescription drug addiction, also heroin addiction, through a House resolution. I believe it's House Resolution 659.
Yeah. House Resolution 659 sets up a task force and advisory committee to look at all the different entities that are involved in this war on drugs. And primarily what we're really looking to address is the prescription drug abuse, the opioid abuse, which leads into heroin. 82% of heroin addicts have said that they had first started or experimented with prescription opioid drugs, primarily painkillers, the Percocets, the oxycodones, Oxycontin, those forms of drugs. Since from 2002 to 2009, as you've really seen these drugs really come into being prescribed and being used, we've seen over a 72% increase in overdose deaths. To the fact that right now, the leading cause of accidental death in the state of Pennsylvania is overdose deaths, and from accidental overdoses from drugs. So I think that we really need to look at this. It is an issue that has impacted Carbon County. We rank 5th per capita in the state as far as counties for overdose deaths, which is not something that we want to be. And Pennsylvania as a whole is 9th. In the nation for overdose deaths. So I think we need to look at it, addressing it every front. We've got every entity from the pharmaceutical manufacturers to the coroner's offices and everybody in between. But you know it's an issue when the Coroner's Association comes to you and says, we need to do something about this. Medical Society has, for the first time now, issued prescribing guidelines for opioids, and they're working on prescribing guidelines for emergency rooms. And it's not really, these are guidelines. We're not looking to go in and tell doctors what to do, but we want to the Medical Society, as the doctors as a whole, want to issue guidelines for prescribing these types of drugs. And I think that was a huge first step. With the Advisory Council that we've set up, we've had our first meeting in June. We have providers from treatment to law enforcement to coroner's office, and what they've come back, and after their first meeting, they had sent a letter to the legislature asking us to pass and provide for a pharmaceutical database for controlled substances and certain types of narcotics, which is something that the Medical Society has asked for, law enforcement has asked for, and something that I hope that we can get done moving into this fall session. We've also passed legislation for a Good Samaritan law that will allow for police officers as well as EMTs to carry a drug called Narcan, which isn't a drug that or hallucinogenic. What it is, it's a drug that's a nasal spray that, if given to somebody who's experiencing an opioid overdose, will bring them out of that overdose like that. It's safe, it has no side effects, and it is something that we're working on getting past. So really looking at it at every front. Also looking at, I was happy in this past year's budget, talking about what we mentioned earlier, that there was an increased funding for treatment and outreach. But I think, you know, one of the huge things that we really need to do is just educate the public on the dangers of these prescription opioids. And I found it interesting in some of the reading that I had done studying up on this issue, is it's not necessarily the dosage, the prescribed dosage, which would cause the addiction issues for a patient, but it's how long that individual is prescribed that dosage. So I think it's important that we really get the message out about the dangers and how addictive these drugs are. Obviously, they were designed for a reason, for terminally ill cancer patients or people that suffer from chronic pain. But as you can see, and you can look at the statistics and the amount of deaths we're seeing, it definitely has to be addressed.
And in many cases, this is a situation where somebody was prescribed a medicine and have become addicted to it, but in other cases it's something that has been found in a parent or a grandparent's medicine cabinet and is now being abused.
Yeah.
To address that, you've set up a bunch of prescription drug drop-off boxes for expired or unnecessary medicines.
Yeah, and that was one of the things that looking at an all-inclusive approach to how we deal with this through education, but also looking at the fact that I think it was 70 or 80% of people that are abusing prescription drugs are getting them from family or friends or from medicine cabinets. So if you have an unused or unwanted prescription at home, or if you don't use that whole prescription, the best thing is to take it back to one of these drug drop boxes and dispose of it. They're located throughout the district: Lehighton, Jim Thorpe, Weatherly, Mahoning Township. I know Palmerton had just gotten a drop box, as well as Lansford, and there's several other communities that are looking for them. And this was provided through a grant program through the Department of Drug and Alcohol that was administered through the District Attorney's Office. So these boxes are free. They're kept in a secure location at the police stations, so it's convenient for people to go back. I think it's so important that as we look at this epidemic that we're experiencing with these opioid prescription drugs, and realizing that leftover prescriptions in a medicine cabinet are very dangerous, and to get rid of them before they fall into the wrong hands. And that's what's really driving a lot of this opioid epidemic. And I think it's, you know, I'm really excited about the response we've got from the local police, all the police chiefs, and from the Mayor's Association, that have really been supportive of this program, and also our district attorney. It's not a partisan issue. It's not a Republican or a Democratic issue. This is an issue that needs to be addressed, because it's affecting not just the safety on our streets, but it's affecting lives.
And you have a track record in the battle to address this issue in sponsoring and holding a drug and alcohol expo starting last year, and you held it again this year. It's been a great success.
Yeah, we had over 30 vendors. We had a great turnout, a lot of the different providers, and really looking for solutions to the problem. And we've held meetings through in the county with county officials. Also worked through PCCD in trying to help different entities. But it's something that I feel very passionate about. It's affecting communities, and when a parent comes into your office and tells you a story about how they lost a child or a loved one to addiction, it certainly is something that we want to prevent. And I think the key is, first is prevention, getting these drugs, the availability of them off the streets, realizing the dangers of the drugs that are out there, and then also at the same time looking to try to get that treatment for the folks that need it.
Now let's talk about outreach. We talked a little bit about your Drug and Alcohol Expo. Similar events are aimed at seniors. You also have events that are aimed at assisting veterans. One of the biggest events, and when I attended last year, you get a really big crowd at your Senior Expo, which is coming up just in a little while.
Yeah, our Senior Expo is a huge event. I think last year we had about 1,200 senior citizens who had come through. We have vendors. It's held at the Jim Thorpe Memorial Hall every year. We do it in conjunction with Senator Senators Dave Argall and Senator John Udicek and myself. The three of us worked together to put on a really nice event. There's a free lunch included in it. We do ask that anybody that's attending the event to bring a canned food for the food bank. That event is will be held this year on September 11th. From 10 a.m. to 1 p.m. at the Jim Thorpe Memorial Hall. I know September 11th is a very honored day in our society, so we'll obviously be looking to do maybe a moment of silence or a program to honor those folks on September 11th. But so it's September 11th, 10 a.m. to 1 p.m. at Jim Thorpe Memorial Hall, and it's open to the public. It's free. There'll be a free lunch included in it, and just a lot of very valuable information for senior citizens.
Do you get the sense that a lot of seniors don't know what kind of services are available to them?
Well, I don't know. I mean, you have people that are just becoming, that are sometimes in their late 50s that want to come out and find out what's available as they may be looking to set up for retirement and looking to plan their the years ahead. We also have some seniors who never really came out or never applied for any types of benefits that are now having to apply, or maybe look into maybe a heating assistance in the wintertime, or want to maybe look into different avenues that are available. We also have, every year we have flu shots available at the Senior Expo. So I think it's for seniors from every level. There's a lot of information there. Another thing that's important, we have the Attorney General's office that comes in, and we also do outreach throughout the district is on fraud and abuse. So often these international crime syndicates target our senior citizens in the state of Pennsylvania or across the nation with frauds, and people will call up and ask for credit card information, personal information. So we generally like to get that information out there. Will be that at the Senior Expo, but we also do outreach throughout the community with the Attorney General's office, and basically what the guidelines are: don't give out any personal information over the phone. And if somebody feels that they have gotten a call, they can obviously call any of my district offices to look into it, or report it to the Attorney General's office.
All right, we have a little bit of time left. Let's talk a little bit about your outreach. You have plenty of outreach for veterans as well, and these are people that have sacrificed quite a bit for our nation. The least you can do to give back is to do these outreach events, which I believe are in conjunction with the American Legion?
Yeah, we have the American Legion outreach specialist comes into our veterans outreach specialist comes into our office in Lehighton, and they come in there once a month. We also do office hours with Senator Pat Toomey's office, generally once a month, and also we have the Veterans Administration has their mobile vet unit, which we have come into Carbon County. One of the Legion posts, generally the American Legion in Lehighton, because of the proximity to the Turnpike interchange. But anybody that's looking for those types of services, they're always listed on my website, repheffley.com, or on my Facebook site. We always like to publicize when those benefits are going to be there. We also work closely with our county veterans administrator as far as for any types of benefits for veterans. And also one of the things that I'd like to take a minute to announce is we did have a bridge naming that was done in our district for a young man who had passed away in Iraq, and I was very happy to get the bridge naming for the 903 bridge in Jim Thorpe. That bridge will be named after our Andrew A.J. Baddock. It will be the Sergeant Andrew A.J. Baddock Memorial Bridge, and that was something that we were really happy to see get done for his mom, for the family, and for the community. He was a great kid, and we miss him, but this is a way to honor his service, but also all the service of our Gulf War and war on terrorism veterans.
All right, thank you, Representative Heffley, and it looks like that will have to be our last question. I want to thank you again for joining me today, and I look forward to talking to you again on the next edition of Legislative Report.